I'm Clarence Broadnax with Midwest Medicare Solutions.
Great. So Medicare is very confusing to people.
Okay, yeah, definitely. Definitely.
One of the things that I've noticed and that I struggled with before we got connected was, what's the difference between Medicare and Medicaid?
Yeah, a lot of people kind of struggle with that. Medicare is federal, so
Okay.
it's through the federal government. So you get Medicare one of two ways: either you
Gotcha.
turn 65, or you are disabled. So you automatically get it when you turn 65, or if you are disabled and you have a federally recognized disability, then you can get Medicare. And then those are the two ways to get Medicare.
Okay, that makes a lot more sense because I could not tell the difference when I met you.
And then Medicaid, to your other question, Medicaid is state-based, so that's just based on income. So if you're so far below the federal poverty line, that's how you get Medicaid.
Gotcha. So could you have Medicare and Medicaid at the same time?
Yeah, you can, there's a lot of people who have both.
Okay.
They're called dual eligible, and then they get a bunch of different like protections that other people who just have Medicare don't get.
Gotcha. Okay,
Yeah.
that makes a lot of sense.
Yeah.
The big question too, you were talking about there's different ways to get it, having a disability or becoming a senior, and we're focused on seniors. So what is a big thing that seniors need to know about how it works for them?
The biggest, I guess, surprise when I'm working with people who are like turning 65 is the fact that Medicare isn't free. So when you get Medicare, for most people, there's a charge to have full Medicare.
Okay.
And they take the charge is based on your income, and it's deducted directly out of your Social Security check. So the first question for people when they get Medicare is they need to have a conversation about whether or not they're going to take Social Security or not.
I never would have thought. That's why I love what you do.
Yeah, that's the first question, because you can get Medicare without taking Social Security, but if you don't take Social Security, then you have to send in a check every 3 months
Gotcha.
for your Part B premium to keep Medicare. If you do take Social Security, they just take it right out of your Social Security check.
Okay.
Yeah, for most people, it's like right now, the Part B premium is like $164.90.
Gotcha.
For most people, and then if you make a bunch of money, they charge you more for it.
Okay, that's something that I think people get super confused about too. Is okay, I'm retiring. I have this new health insurance, and then on top of it, there's all these parts to it. So is it A, B, C, and D?
Yeah. So original Medicare, which is what you get on your red, white, and blue Medicare card, that's Part A and Part B. So Part A is hospital coverage.
Okay. So what you would traditionally think of?
Yeah.
More?
Yeah.
Okay.
So that's Part A. You get that at no charge, as long as you work 10 years or more, and you worked a job where they were taking FICA taxes out of your check, like Medicare and Social Security. As long as you got those 10 years, you get that for no charge. Part B is an election. You don't have to take Part B, but most people do take it because they need the medical portion of Medicare.
Okay.
That's what allows you to go to like the doctor's office or get blood work or X-rays or something like that. So that's Part B. That's what they charge you for. That's what we were just talking about. And then Part D is prescription coverage. So that red, white, and blue card does not cover prescriptions.
So that's a separate card.
That's a separate card. So that's a separate. There's like a million different insurance plans that offer a Part B. You can just sign up for them. They're like 30. Most of them are like anywhere between like 10 to $40 a month.
Gotcha.
And then Part C, that's what you see advertised on TV all the time. That's what I do and what a lot of other insurance agents do. They're called Medicare Advantage plans, and they combine Part A, B, and D into one plan. So like a Medicare Advantage plan will resemble like your employer plans, which you're used to, when you were working.
So it's more like an umbrella, all-inclusive.
Yeah, it's all-inclusive. Yep, it's all-inclusive, so it combines everything. And what it does is there's two ways to get Medicare. You can have traditional Medicare, where you go to the doctor, you show your red, white, and blue card, your doctor bills that card, and then you pay the co-pays and deductibles of that red, white, and blue card.
Right.
Or you can enroll into a Medicare Advantage plan, which is like a private insurance company's version of Medicare. And then that becomes your primary insurance. So you still have Medicare, but you're not using your red, white, and blue card. You're just using the Medicare Advantage company that you signed up for.
Gotcha. And is that still on that sliding income scale?
Nope. So there's no income requirement to have a Medicare Advantage plan.
Okay.
You just got to have Part A and Part B on your Medicare.
Gotcha.
And then anybody can sign up for a Medicare Advantage plan. Now, while there's no income requirement, there are plans that are specifically designed for people who have Medicaid.
Okay.
Those are called like dual special needs plans. And the actual plan doesn't have an income requirement, but to have Medicaid, your income has to be below a certain threshold.
That makes sense. Okay.
Yeah.
So for me, now I know the difference. I'm a senior, and sometimes it's even like you've been in this plan for a long time, right? Mm-hmm. And now you're in a difficult situation. Is it often that people need to have conversations about if they're in the right plan, or is it pretty like a set it and forget it situation?
No, I would say at least once a year, right? It's a really good idea to review your plan, to take a look at, is it still meeting your needs? I mean, a lot of times, if you're just on a plan and the premium is starting to creep up and up and up, mm-hmm. right? I mean, a lot of times you can just get something very similar for half the price of what you're paying for your existing plan.
So if it's creeping, but that, a lot of times people don't know what to look for. There are some common mistakes that people make. Like, I wouldn't do this on my own. I would call you. But what are some common mistakes that people make? One of the
more common mistakes is people assume that the more money they pay, the better insurance will be.
Okay.
And for Medicare, it's usually never like that. Most Medicare Advantage plans are zero. They don't cost anything to sign up. And some of the plans that do have a premium very rarely have benefits that justify paying $100 or $150 a month, where you can get like a $0 plan that does the same thing.
So are there certain things that our family members should be looking out for as triggers of like something changed, you should get this looked at?
Skilled nursing. So if somebody goes into a skilled nursing facility, a lot of people don't know that gives you a one-time opportunity to make a change in the middle of the year.
Okay.
So if you're admitted to a skilled nursing facility or discharged from a skilled nursing facility, that gives you like a little window to make a change. If mom or dad is recently prescribed a really weird medication, mm-hmm. and the current plan isn't really covering that, that's a good opportunity to maybe call somebody and say, hey, can you, look at this plan, look at this medication. Is there something that we can do? Life changes, right? You lose your job, mm-hmm. you get a job, you move. Gotcha. Those are really good opportunities to take a look at your plan and see if you might be able to get something better.
Okay, that makes a lot of sense. And another question that people have is, okay, I'm retiring. Am I taking Social Security? Am I going to be on Medicare? But they might have insurance in their retirement from their previous job.
Yeah.
So how do you manage those conversations?
Yeah, so those are actually really simple, right? So for most people, we see that a lot, like here in Michigan, just because we got a bunch of people who work for like the big three, like the auto companies. So if you have like one of those retiree benefits, like 90% of the time, you don't need to do anything for Medicare.
Okay.
If you can keep that plan and have Medicare, that plan is always primary, and then Medicare is usually secondary. A lot of times for like some of the older plans, the retiree benefit isn't linked to your Medicare at all. So it has nothing to do with your Medicare.
Okay.
So you can keep those plans. You don't need to, like all the commercials and the advertisements that you see on TV, you don't need to do anything with that. Just kind of steer clear of those advertisements, people trying to sell you stuff. If you have retiree coverage, 9 times out of 10, you're good. You don't need to do anything. And that's usually from like teachers or postal workers or people who retire from the big three. Those are usually where we see that at.
Gotcha.
Yeah.
And that's one of the things why at How to Help Mom, it's like super important that we work with people like you, because you're saying, hey, 90% of the time you're fine, which not everybody's like that. So that's such a benefit to working with Clarence and what he does.
Thank you.
So we've had some conversations about the difference between your employer's insurance and then Medicare, but what are differences between an Advantage plan and then a supplement?
So a lot of people use those terms like interchangeably. They'll use the term Medicare supplement to describe a Medicare Advantage plan. And they actually work completely different. So there's basically two ways to have Medicare. You can have original Medicare, or you can opt into a Medicare Advantage plan. Mm-hmm. If you have original Medicare, for the most part, Medicare pays about 80% of your costs. Like if you just went to the doctor and showed your red, white, and blue Medicare card, it would cover 80% of your costs. Okay. And then you'd have a 20%, remaining balance. So a Medicare supplement is used just to cover that 20%.
Gotcha.
So in that example, Medicare is your primary insurance and the supplement is secondary. Mm-hmm. The supplement does not include prescription coverage. So if you need prescription coverage, you need to purchase that separately. It also doesn't include dental, vision, or hearing. So if you need any of that, you have to purchase that separately. But the perk to the Medicare supplement is that there's no network requirement. So you can see any doctor.
You're like a free agent.
Yeah, free
All
agent.
Right.
Yep, there you go. You can see any doctor in the country as long as they take Medicare. You can travel. The plan, for the most part, if you choose the right Medicare supplement, it'll cover everything. So no copays, at least for the medical standpoint. No medical copays. All you got to do is pay your premium. You don't have to get like authorizations or referrals or all that stuff.
That saves you a lot of headaches.
Yeah. Especially like here in Michigan, we have a lot of snowbirds.
Yeah.
So if you're somebody who travels, or if you're living in Michigan and going to Arizona for half the year, those work out really well because you can just leave and see any doctor you want in Arizona or outside the state.
I love that.
Yeah. Whereas like a Medicare Advantage plan, and back to the price. So those are usually kind of pricey. They're about, $100, $150 a month. But you got to factor in your prescription coverage and then dental, vision, and hearing. So that usually ends up being about like, $200, $250 a month or something like that. Whereas like the Medicare Advantage plans, those are ran by the federal government. So for the most part, those are $0 a month.
Gotcha.
You can sign up for that. But when you sign up for those plans, they become your primary insurance. So you have to follow all the rules and regulations of that plan. So if that plan says, hey, if you go to see a specialist, you got a $45 copay, that's what you pay. If you have to get authorizations for surgeries, then you have to get the authorization. They have the final say on whether or not the surgery gets done.
Gotcha.
There's a network, so you have to see specific doctors within the network. So they're not as flexible, I would say, as a Medicare Advantage plan, but they're all inclusive. So the dental, the vision, the hearing, prescription coverage, it's all included. And for $0 a month, right? If you're fairly healthy, you're not going to the doctor that often, you don't mind paying some copays, right. That's usually be a really good bargain for people.
Oh, absolutely. And to be honest, this insurance is just overwhelming for people to start. Yeah. I always feel like I've always felt like insurance is one of those things where it's this thing in the air, and even though I'm paying for something, I never know if it's actually going to cover anything.
Yep.
And you're talking about these cool advantages between supplements and the Advantage plans, which I would never know that. I wouldn't even think, a supplement could add onto this. It's a lot to know. Yep. What are the processes that you go through if I'm somebody who, I'm taking care of my parent, or, I'm looking at retirement and I'm trying to figure out the right plan? What does the intake process look like for you? What should I have ready or out for you?
If you have their Medicare number, Medicare card, the names of their doctors, names of their prescriptions, all their prescriptions, that's usually very helpful for me. And then we just gotta have a conversation. So we'll sit down, and usually my first conversation is, if somebody's turning 65, hey, are you taking Social Security? Right? We'll have a conversation about that. Usually they are. And then at that point, we just need to figure out, do you want to do a Medicare Advantage plan, or do you want to do a Medicare supplement?
Okay.
And that conversation usually goes something like, do you travel often? Do you see a bunch of different specialists? Because if we put you on an Advantage plan and $0 a month, but the copay is $45 to see a specialist, and you're seeing 6 specialists a month.
Yeah, that can rack up.
Right, that would add up. We should probably just do an Advantage plan or a supplement. You pay, $200 flat, and now we know, hey, regardless of how many times you go to the doctor, you're only going to pay this $200 a month. Versus having some months where you pay, you might go to the doctor 7-8 times, right?
Yeah.
And end up paying $300 or $400 in copays.
That's a lot of savings. Is there a lot of issues that seniors have, not just with the copays, but with prescriptions. Like, how do you help with that?
Prescriptions is usually one of those like hot button items, right?
Yeah.
For me, it usually revolves around insulin. That's I get like 90% of my business from insulin. People having trouble getting insulin, they're reaching out to me to say, "Hey, can you help me with my medication?"
Gotcha.
And a lot of times, it's just easier to just change the entire insurance plan to get better prescription coverage, as opposed to trying to, you know, nickel and dime here and there to try to get some savings. It's usually just easier just to change the whole thing. And
that makes a lot
some
of sense.
savings there.
Okay. And so there's these insulin issues, all of those things. There's a lot of legislation that goes in this.
Yeah.
So what are some things that and I know you have a team of people that work with you.
Yeah.
Kind of do or like have to stay, in the know?
Well, just like a real estate agent, we do CE credits every 2 years, so we got to maintain our license. And then there's a certification. You have a health insurance license, and then there's a separate annual certification that we have to do to be able to market and sell Medicare products.
Okay.
So every year during that certification, we are made aware of all the different legislative changes, how they affect us, how they affect our clients. There was one that just recently passed about insulin, where for most people, they capped the insulin copays at $35.
Okay.
So regardless of what plan you have, regardless of what insulin you're on, as long as that drug is covered by your either your Advantage plan or your Medicare prescription drug plan, for the most part, it's capped at $35.
Okay.
And it wasn't like that before. A lot of times, insulins would be $90 or $150, and a lot of seniors on fixed incomes. So you would get into situations where people were making decisions about, should I buy my medication this month or should I buy groceries this month?
Yeah.
So that helped out a lot.
That's something in our relationship that I've always loved hearing about the people that you've helped. What are kind of like your favorite situations where you've kind of gone in and really changed the trajectory of people's lives? I mean, you don't think about how like what you're doing on a huge level can really affect somebody's life until you're in that position, So
I've had a bunch of clients who are on like there's no right or wrong way to do, like, if you choose a Medicare supplement or a Medicare Advantage plan, but I've had people in situations where they were on Medicare supplements, and like one lady in particular, her husband did all the bills and did all the insurance. He passed away, and she was living off of his Social Security check, but it was, it was very fixed income.
Yeah.
She purchased this Medicare supplement like in the late 90s, right? So this was maybe 2 years ago.
It's seasoned a little bit.
Yeah. So by the time I got to her premium was like almost $900 a month.
On a fixed income?
Yeah, on a fixed income. I think like 80% of her, because it was just Social Security, that was her only income. Like 80% of her Social Security check was going to pay that premium. And she was surprisingly healthy, right?
Right.
Like she was, she was active, mentally she was there. So we just showed her an Advantage plan, and it was $0 a month. She got a ton of dental, a ton of vision. She got a over-the-counter allowance where she could like go to CVS and purchase like her little vitamins or cough drops, and they gave her hearing aid coverage, which she didn't have with her Medicare supplement, and saved her $900 a month.
If you go back and calculate like $900 a month since the 90s, that's
so
heartbreaking.
Yeah, and it, like
people need to call you. Please call.
Yeah, and when she got it, it didn't start off like that.
Right,
right?
I'm sure it
was fine, but she got older, and the premium just went up and up and up, right? Because she's becoming more riskier to insure as she's getting older. It's like car insurance, right? And it just saved her a ton of money.
There's a lot of savings that you can get people, and there's also one of the things that's interesting about what you do is a lot of people who just deal with typical insurance are like, well, you can do this or you can't do this. and then they shuffle them off to like somebody else. But you're kind of the guy who's like at the end of the line, can handle everything for the most part. So what are some of the things that you do that are different from other people where you kind of take on these folks that haven't had opportunities everywhere?
I think what kind of separates me is that I just work with, everybody. So there's a lot of people who do senior insurance, Medicare, and they might only work with a particular income bracket, or they might only work with a particular client. Like they just might see people who are just turning 65, but they won't work with people on disability or so forth and so on. I think what kind of separates me and my team is that we work with everybody. So we work with the, little old lady who's got 17 different cats, right? And we do that.
I do love cats.
Yeah. We do that. And she's on a fixed income, and she's just trying to, figure out how she's going to make it through the month and feed all her cats. And then we work with somebody who's just been an entrepreneur all their life. They're retired. They got a bunch of different assets, and they're trying to figure out how Medicare is going to work, what some tax strategies that they can use that Medicare might be able to help them with. We work with, people turning 65, people who've, been on Medicare for forever, and they're just looking to get some different options, some savings. We work with a ton of people on disability. They've just got disability, and because they're not 65, nobody's really like marketing to them. So you just get a Medicare card in the mail, and that's it. Like nobody gives you any instructions. Nobody's calling you trying to give you any information. So, we just, the whole gambit of Medicare, that's what we do.
That's amazing. So you kind of take on all of these people who get ignored, which is amazing.
Yeah.
You mentioned cats and entrepreneurs. So if I am an entrepreneur and a cat lady.
Okay.
So if I'm coming to you, if we go through a scenario, I know that you go through a training with your agents.
Yeah.
What might that look like for me imagining that I'm turning 65 with
I got you. Yeah.
I'm hoping not 17 cats. I want to be capped at 2.
Yeah, so I got you. Yeah, so like when I train new agents, I always take them through an exercise. So I'll do it with you. So we try to determine if you were turning 65, right, what would you decide to do? Would you purchase a Medicare supplement, or would you do a Medicare Advantage?
Gotcha.
So I'll give you some information. So with the Medicare supplement, let's say your premium is going to be about $150 a month. Okay.
Okay.
Would you want dental coverage with that?
Yes.
Okay, so you need dental.
My dad paid for braces twice. I need to honor him.
You didn't wear the retainer?
I wore it, and then my dog ate it, and I was like, oh, well, it's been long enough. It wasn't.
It just went back.
Yeah.
Yeah, that happened to me too. Yeah.
Kindred spirits.
So you need dental. Okay. And then you need prescription coverage, correct?
Right.
Okay. Do you go to the doctor that often?
I go for my yearly appointments, and I was a partier when I was young, so now I have diabetes.
Okay, I got you. All right, so let's do some math. So your premium is $150 plus $30 for your dental plan, plus let's say another $30 for your prescription plan. So that's $210. Times 12, that's $2,520.
All right.
So that's going to give you the ability to travel, see any doctor you want, not have to deal with referrals or authorizations.
Okay.
The Advantage plan will be $0 a month. Okay.
Gotcha.
It's going to include prescription, dental, and vision.
Gotcha.
Do you see any specialists, or you just seeing your primary care doctor?
My hearing's going.
Okay.
I don't know if it's selective or not.
Selective. All right. So you got to see like a ENT doctor or something like that. Okay. And then you're probably seeing them once a year, twice a year.
Yep.
All right. So the copay for your Advantage plan to see your specialist will be $30.
Gotcha.
To see your primary care doctor is going to be $0.
Okay.
So $0 premium, $0 copay to see your specialist. Your primary care doctor.
Okay.
You're gonna have a $30 copay to see your specialist. You're gonna get a dental, vision, hearing, and OTC allowance. So that's gonna be included with your plan. You can go with that OTC. You can go to CVS, Walgreens, buy any little household items that you want. You can buy cat food for your cats if you want.
Yeah.
That's just going to be included with the plan. So let's figure out what you want to do. On that Advantage plan, you have a max out of pocket. The most you can pay, your copays could add up to is $4,000. Okay.
Okay.
Based on what you just told me, you would pay about $60 a year.
Gotcha.
If you saw your hearing doctor
right.
twice a year.
Okay.
Primary copay is $0. You're not, your prescriptions are covered at 100%. Okay. However, if you do get sick, it'll be about, your copays could potentially add up to about $4,000.
Okay.
Right? Versus the 25/20, where we know that your premium, what did we say, $220, $250, something like that a month. If over the course of 12 months, that's all you're paying versus the supplement. So
the supplement I could pay $4,000.
With the supplement, you're gonna be capped at not capped, but your premiums could never exceed $200 a month. Okay. But you're gonna pay that regardless if you use it or not.
Okay.
So that's gonna add up to like $2,000, $2,500 for the year. The Advantage plan is $0. So if you don't use the Advantage plan, you're not gonna pay anything. If something
I'm really kind of just paying $60.
Yeah. However, if something catastrophic happens, your copays are capped at $4,000. So it's $4,000 versus like $2,500. So do you want to roll the dice and do the Medicare Advantage plan? Because you're like, I'm healthy. Why would I pay $200 a month for something that I'm not really using?
Right.
Or would you just rather be on the safe side and say, hey, let me just get it now. And then if something happens, at least I know I'm covered.
I mean, I think for me, I'll just plan to save over the years in case I need anything to get to that $4,000 rather than just continually paying it.
Right. So that's the conversation we had, and that's the conversation we have with clients.
I like that though because I get to make my own decision, but I know how to do it.
Yeah, yeah. Now, one thing I didn't talk about with the supplements and the reason that people are marketed to so aggressively when they turn 65 is you can always get a Medicare Advantage plan.
Yeah, because they want that guaranteed $200 a month from you.
Yep.
Okay.
You can always get a Medicare Advantage plan at any time, any age. The Medicare supplements are underwritten. So when you first turn 65, you can purchase one, no questions asked, no health questions, nothing. After you turn 65, there's like 30 different health questions that you have to be able to answer no to in order to purchase a Medicare supplement. So
maybe if I have a huge family history and I know eventually it's not an if I'm going to get something, just a matter of when. Then when I'm 65, I might just buy into that.
Yeah. So it's not
$200 a month one.
Yep. So for some people, right, if you're just adverse to having to deal with authorizations, referrals, maybe it's not the copays for you. Maybe it's, hey, if I get cancer, I want to go to the Cleveland Clinic.
Gotcha.
And the Cleveland Clinic I know is not in this network.
Gotcha.
So I would rather just let me get it now while I'm healthy, while I can qualify for it. And then if, God forbid, I got to go to some crazy, exotic cancer treatment in California, I can just go. Versus having the Advantage plan and no, they're not in your network.
Gotcha. So the Advantage plan kind of locks you in where you're at.
Right.
And then you're paying, but you're also guaranteeing that you have options when you need them. Yeah. That's a really difficult decision to make at 65.
Yeah.
Especially as people are living longer and longer.
Yeah. So. Yeah. And again, there's no right or wrong.
Right. Yeah.
It's just whatever you're comfortable with. Me, I would probably do the Advantage plan, but again, I'm 34 and I'm pretty healthy, right? You said the Advantage plan too, right? Yeah,
but now that I'm thinking about being locked in is my I'm probably maybe thinking about it differently than I will when I'm 65.
Right.
If my mom just, spoke to you and is going through retirement and has had to make those decisions. And for me, I'm like, well, I want to be able to take mom to Cleveland. So
right. There you go.
It depends on what your economic place is at too.
Yeah.
So that makes a huge difference. And it's interesting too, because you have this very successful business with people who work for you and you're 34, being in what you do selling this type of insurance is not common. So how did you get into doing Medicare?
It's weird how I got into Medicare. My degree is in health administration. So like I knew about Medicare when I was in school. We learned about it, and I ended up working for a health plan here in Detroit and was doing that for a while. And then the sales director just came down one day and he was like, you should do sales. And I'm like, all right, I guess, So, we started doing training for Medicare. We used to go out into the field. We would go to people's houses and, you sit down and you have conversations with people. And I just liked it. I just liked not having to be in the office. I just liked making my own schedule. You do your job, you go home, as long as you're doing what you need to do. Nobody calls you, nobody bothers you. So I loved it. It was weird. I would have did that forever. And then just randomly, they just laid off everybody. Right? Okay. So I ended up starting my own agency. It was hard because I'd never been an entrepreneur before. Right. So I had to go through those growing pains. But yeah, once I figured all that out, I would never go back to a regular 9-to-5 job. I would just be scared I would just get laid off again. Yeah. So I'd rather just, control my own destiny. You're here to stay.
So when people sign up with you, you're going to be the guy.
Yeah, I'm the guy. I'm not going anywhere. You can call me. If the plan that I put you on is not working, something's changed, you call me, we'll figure it out. We'll get you on something else.
That's also kind of a great advantage to using you too, is like as you're 65 and aging, you're barring anything else going to be doing this for a while. So it's nice to have that continuity. Yep. Between like where you started and
a lot of times you'll call into an insurance company and you're just gonna get just the agent of the day, right? Who just answers the phone, and that's not their career, that's not what they're passionate about, so they're just there passing time, whereas this is what I do. So I'm not going anywhere.
And have multiple people who do it with you, so that's super important. So for our families who are gonna need your services, they've gotten to learn everything they need, except for how do we get in contact with you to help us?
Best way, just give me a call. 248-864-8301 comes directly to me. We just actually took our website down because we're gonna rebranding and all that stuff. But that's the best number, 248-864-8301. You can also find me on Facebook if you just Google Midwest Medicare Solutions. I'm the first one that pops up, so you can't miss me.
Fantastic. Thank you. And this is Sarah with How to Help Mom and
Clarence Broadnax, Midwest Medicare Solutions.